Allergies are a part of life for many people, but for some, they can be life-threatening. Anaphylaxis is a severe allergic reaction that can cause difficulty breathing, swelling of the face and throat, and a drop in blood pressure, among other symptoms. The only way to treat anaphylaxis is with epinephrine, a hormone that helps to reverse the symptoms of an allergic reaction. In this video, we will explore the role of epinephrine in managing life-threatening allergic reactions, including what it is, how it works, and why it's so important for those with severe allergies to carry an epinephrine auto-injector at all times. We will also discuss some of the common myths and misconceptions surrounding epinephrine, so you can feel confident in your ability to use this life-saving medication if the need arises. How does epinephrine work in the body? Epinephrine, also known as adrenaline, is a hormone that is naturally produced by the body. It is released during times of stress or danger, causing an increase in heart rate, blood pressure, and breathing rate. When it comes to allergies, epinephrine works by constricting blood vessels and relaxing the muscles in the airways, which helps to reverse the symptoms of an allergic reaction. Epinephrine is administered via injection, typically into the muscle of the outer thigh. The injection is quick and easy to administer, and the effects of epinephrine can be felt within minutes. In severe cases of anaphylaxis, multiple injections may be necessary. It's important to note that epinephrine is not a cure for allergies, but rather a way to manage the symptoms of a severe allergic reaction until medical help can be obtained. Importance of administering epinephrine during anaphylaxis. Anaphylaxis is a medical emergency that can be fatal if left untreated. The symptoms of anaphylaxis can progress rapidly, so it's important to administer epinephrine as soon as possible. Delaying treatment can lead to a more severe reaction, which can be harder to manage and potentially life-threatening. The use of epinephrine during anaphylaxis can help to reverse the symptoms of an allergic reaction, including difficulty breathing, swelling of the face and throat, and a drop in blood pressure. Epinephrine can also help to prevent the progression of anaphylaxis, which can be especially important for those with severe allergies. Anaphylaxis is a severe and potentially life-threatening allergic reaction that requires immediate medical attention. In this comprehensive guide, we will explore the causes, symptoms, and emergency treatment of anaphylaxis. By understanding this condition and its management, individuals can be better prepared to respond to an anaphylactic episode and seek appropriate medical care. What is anaphylaxis? Anaphylaxis is a rapid and severe allergic reaction that occurs when the immune system overreacts to an allergen. Common triggers of anaphylaxis include certain foods, medications, insect stings, and latex. When exposed to an allergen, the immune system releases chemicals, such as histamine, that cause a cascade of symptoms throughout the body. Signs and symptoms of anaphylaxis. Anaphylaxis can be caused by a variety of allergens, including foods, medications, and insect stings. The symptoms of anaphylaxis can vary from person to person, but they typically include: anaphylaxis can affect multiple organ systems, leading to a range of symptoms that can develop rapidly and progress in severity. Common symptoms of anaphylaxis include skin reactions. Itching, hives, swelling, angioedema, and flushed or pale skin are common skin manifestations of anaphylaxis. Respiratory distress. Wheezing, shortness of breath, difficulty breathing, and a tight feeling in the chest may occur due to the narrowing of the airways. Cardiovascular effects. Anaphylaxis can cause a drop in blood pressure, hypotension, weak or rapid pulse, dizziness, lightheadedness, and even loss of consciousness. Gastrointestinal symptoms. Nausea, vomiting, abdominal pain, and diarrhea may occur as a result of anaphylactic reactions. Swelling. Swelling of the lips, tongue, throat, or other areas of the body can occur and may contribute to airway obstruction. If you or someone around you experiences these symptoms after exposure to a known allergen, it is crucial to act quickly and seek emergency medical attention. It's important to note that not all symptoms of anaphylaxis may be present in every case. Some people may only experience a few symptoms, while others may experience all of them. It's also possible for symptoms to come and go, which can make it difficult to know when to administer epinephrine. If you suspect that you or someone else is experiencing anaphylaxis, it's important to administer epinephrine and seek medical attention immediately. When to use epinephrine and how to administer it. The use of epinephrine during anaphylaxis is crucial, but it's important to know when and how to administer it. Epinephrine should be administered as soon as possible after the onset of symptoms, even if you are unsure if it's an allergic reaction. Delaying treatment can be dangerous and potentially life-threatening. When administering epinephrine, it's important to follow the instructions provided with the auto-injector. The injection is typically administered into the muscle of the outer thigh, and it's important to hold the injector in place for several seconds to ensure that all of the medication is delivered. After administering epinephrine, it's important to seek medical attention immediately, even if the symptoms have subsided. Common misconceptions about epinephrine use. There are many myths and misconceptions surrounding the use of epinephrine during anaphylaxis. One of the most common misconceptions is that it's better to wait and see if the symptoms will go away on their own. This can be dangerous, as delaying treatment can lead to a more severe reaction that is harder to manage. Another misconception is that epinephrine is only necessary for those with severe allergies. While it's true that those with severe allergies are more likely to experience anaphylaxis, anyone can experience a severe allergic reaction. It's important for everyone to carry an epinephrine auto-injector, just in case. Epinephrine auto-injectors and their proper use. Epinephrine auto-injectors are designed to be easy to use, even in high-stress situations. There are several different brands of auto-injectors on the market, and it's important to choose one that you feel comfortable using. When using an auto-injector, it's important to hold the injector firmly in your hand and remove the safety cap. Then, place the tip of the injector against the outer thigh and press down firmly to release the medication. Hold the injector in place for several seconds to ensure that all of the medication is delivered. After using an auto-injector, it's important to seek medical attention immediately, even if the symptoms have subsided. Anaphylaxis can be unpredictable, and it's important to be monitored by medical professionals to ensure that the reaction does not progress. Epinephrine alternatives and their effectiveness. While epinephrine is the most effective treatment for anaphylaxis, there are some alternative treatments that may be used in certain situations. Antihistamines, such as Benadryl, can help to relieve some of the symptoms of an allergic reaction, but they are not a substitute for epinephrine. Corticosteroids, such as prednisone, can also be used to help reduce inflammation and swelling, but they are not a first-line treatment for anaphylaxis. These treatments may be used in conjunction with epinephrine, but they should never be used as a substitute. Epinephrine in emergency medical settings. Epinephrine is not only used for anaphylaxis in the community setting, but it's also used in emergency medical settings. In these situations, epinephrine may be given intravenously or via an endotracheal tube in the case of severe respiratory distress. In some cases, epinephrine may also be used to treat other medical conditions, such as cardiac arrest or low blood pressure. The use of epinephrine in these situations is different from the use of epinephrine during anaphylaxis, and it's important to follow the instructions provided by medical professionals. Conclusion: the importance of being prepared for anaphylaxis and having access to epinephrine. Anaphylaxis is a serious medical condition that requires immediate treatment. The use of epinephrine during anaphylaxis can help to reverse the symptoms of an allergic reaction and prevent the progression of the reaction. It's important for those with severe allergies to carry an epinephrine auto-injector at all times and to know how to use it correctly. In addition to carrying an epinephrine auto-injector, it's important to be prepared for anaphylaxis in other ways. This may include avoiding known allergens, wearing a medical alert bracelet, and having an emergency action plan in place. By being prepared and having access to epinephrine, you can help to manage the symptoms of anaphylaxis and potentially save a life. Thanks for watching.